Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a as part of a segmental Scruples edition or series. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, a little bit around theme one and the sort of lack of renal health in transfusion care strategies for patients with sort of long with for patients or recipients for with chronic illnesses, long-standing conditions or long-term conditions and chronic illnesses. So the literature derived under this theme highlighted that whilst there had been an increase in research and informed practices around red blood cells, around red blood cell transfusion care or RBTs for recipients who may require this form of treatment or these forms of treatment, the literature also informed that renal health in transfusion care strategies for patients or recipients is yet to be acknowledged in more depth. Only in the last decade, for example, have such studies considered transfusion as a risk factor, utilizing multivariable logistic regression or propensity score methodologies to determine if perioperative transfusions are independently related to, for example, acute kidney injury or AKI. In 18 different investigations that identify perioperative transfusions to be an independent risk factor for AKI, acute kidney injury, the effect size varied, which is not surprising given that they use different definitions around acute kidney injury. Controlled in around acute kidney injury and controlled for different covariates and categorized and analyzed transfusions differently. Nevertheless, taken together, these investigations had suggested that each unit of perioperative blood transfusion or RBT is independently associated with in around 10 to 20% increase in the risk of acute kidney injury or AKI. AKI is an issue because it can lead to CKD, can lead to chronic kidney disease, can lead into chronic kidney diseases stages stages CKD stages 4 to 5 over time, and so the decision to transfuse is also influenced by numerous factors that are unmeasured in retrospective observational investigations, such as the severity of pre-existing comorbidities and the extent of intraoperative bleeding, and hence cannot be accounted for by multivariable statistical investigations. Observational studies comparing transfused with non-transfused recipients or patients can overestimate the risk of transfusion. Another important issue is that some important risk factors for AKI or acute kidney injury are likely or probable to be interrelated with transfusion, making it challenging to account for independent effects by multivariable statistical testing. And again, this all highlights further that there is still a lack of renal health in transfusion care strategies for patients or recipients with CIs or chronic illnesses, since the majority of patients or recipients have preemptive or perioperative complications, anemia perhaps being the most pertinent. Individualization of anemia management at the same time has appeared as a consistent theme throughout several guideline and recommendation works, and this is highly important to the utilization of RBTs in recipients or patients with a chronic illness, or a long-standing or long-term condition. And so, because of improving the skills, for example, at the prevention and treatment of rejections in the rejections where where RBTs RBTs sort of RBTs sort of guidelines are what RBT guidelines are concerned. The advantage or the beneficial of effects of random transfusion population as a whole is marginal. This comes at a time when communities when community sort of can can have or may have anxieties, for example, are in around bloodborne infections, and prospects of supporting red cell production by the use of, for example, erythropoietin or EPO, which have or had emerged as sort of as sort of new factors in around sort of blood banking. Observations on patients at risk for renal rejection, namely those who have episodes that indicate that beneficial blood transfusion effect still exists. However, and so future sort of works of deliberate human leukocyte antigen or HLA exposure in conjunction with novel immunological manipulations may provide a more effective avenue to tolerance induction, and this use of blood transfusions matched for one HLA loci or antigen with recipient has produced sort of major advantages in preliminary trials and represents sort of at least one starting point. Retrospectively, at the same time, it has been stated that more investigations are required to help answer questions as to the risk of sensitization with a previous transfusion and the value of perioperative transfusions in patients or recipients with long-standing conditions or chronic illnesses. And it still appears that there is a lack of renal health context in transfusion care strategies for patients with long-standing conditions or chronic illnesses. The topics that surround this intriguing yet diverse sort of entity have been outlined in sort of published works, in some published works sort of retrospectively, and yet there is still an ongoing dilemma because of potential antibodies that may arise over time and sort of post transfusion in such recipients or patients. And it is also important to note that the team one team had identified or had found that the hemoglobin level on the sort of functional status and comorbidities most influence transfusion decision mostly influence sort of transfusion decisions and informed decision making. Transfusion preferences also vary by provider or service provider, region, experiences, and practices. And where renal health is concerned, it is evident, for example, that specialists, for example, nephrologists value renal health more so than non-nephrology or non-renal specialists or non-renal specialisms, suggesting that such health professionals sort of lack an awareness about how transfusion induced allosensitization may impact patients or recipients or sort of renal health, irrespective of patients with or without CKD or chronic kidney disease or with or without sort of renal sort of anomalies. That draws this audio podcast to a close. This audio podcast as part of a Segmental Scruples edition or series. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics and this audio podcast as part of a Storm Robotics production.